All right, so I think we'll go ahead and get started. Thank you again, Peggy. I'm Dr. Arca, and with me today is Dr. Iser, and we're going to be talking about advocacy as part of the treatment plan. And I don't have any relevant disclosures for this talk, but Dr. Iser does currently serve on the board of directors for Miles for Migraine. So the basic objectives of our talk today are to learn how advocacy is in fact a critical part of your treatment plan, and to understand that unifying language sets the foundation for discussion of migraine. We're going to learn how to make an invisible disease visible and how to incorporate advocacy into your treatment plan.
And so one of the things we're going to talk a lot about today is, why would we need advocacy? And part of that is because overall societally, there is a lot of stigma associated with migraine disease. And that can come from our family, our friends, our coworkers, and even people, who love us and care about us sometimes can kind of be a little dismissive or belittling of what you may be experiencing with migraine disease. And because of that, we often will have inadequate accommodations for those with migraine disease, whether it be at school, at work. And so they're often, when you say, I'm having a really bad migraine attack, I don't know if I can come into work or come into school today, they may be a little bit dismissive and say, well, I have headaches or I have migraine and I'm still coming into work. So we unfortunately have a lot of inadequate accommodations for that. It can also be when it comes to medications that it can be really difficult to afford them, especially with a lot of the newer medications that started coming out in 2018. They're quite expensive because they are new, but they can obviously be very effective. So we often have to advocate for making them more accessible for our patients. Now, one of the things we're also facing with these newer medications is that insurances sometimes obviously have preferences of which medications you have to start with, or maybe you have to try these 1 to 2 different medications before we can move on to something else that we think may be more effective or has the less side effects. And there's so much variability within each insurance company and then from one insurance to another. So it can be kind of frustrating. So we have to learn to advocate also for that and to make it more accessible for our patients. And then there's also the general accessibility to care. So we already know that there's a huge shortage of neurologists in the country. So it can be hard to find someone who can more appropriately treat you. And then even within that, there's even fewer headache subspecialists. And there's only about 750 in the country. So if you have a more severe case of migraine disease, it can be hard to find someone who can treat you and help give you a lot of the different options and even come at it from a different perspective.
And so part of the reason why all of these systemic issues facing people with migraine exist is because of undereducation. Even in the medical field, people don't fully understand migraine, let alone in the general community and places where people work and people go to school. And because of this, there's also lack of research and the associated funding. I think Peggy had mentioned some of the advocacy organizations that we work with, things like Headache on the Hill. We're working towards getting adequate funding appropriated for migraine research, given how predominant this disease is in society. But right now, based on the prevalence of migraine disease, the funding that we have available for further researching treatments and cures is not there. And then, of course, there's just this culture of misunderstanding, as Dr. Iser was mentioning, about migraine and other headache diseases.
And so the solution here is that we should be prescribing advocacy. And so whether your healthcare provides it and recommends you do advocacy, or whether you're just noticing that you need to go ahead and get involved, that's one of the things that we really want to do. So we want to start trying to reframe not only our own view of migraine disease, but also of other people's views of migraine disease, whether that be our own providers or even our family, our friends, our coworkers, or our classmates. And so this is one of the ways we can start to do that and start to help create change. It's going to start with us.
So what are we talking about then when we're talking about advocacy as part of the treatment plan? So this is going to be something that involves you as the patient as well as your provider. And Dr. Iser and I actually give this lecture to other headache providers, but we're focusing on the patient side today. This is not your typical treatment plan where you see your doctor and your doctor recommends a treatment and they say, come back in 3 months, let me know how it went, we'll make some adjustments. This is focusing on things that you say during your office visit to your provider, ways that you can make your disease visible during that office, and even shattering any stigma that you might encounter. This is going to be 4 office visits with your doctor, social interactions, other professional interactions. And so again, we're going to focus on those 3 things I mentioned earlier: migraine language, disease visibility, and shattering stigma. And then we've got a kind of a fun part at the end of this with migraine comeback.
And so one of the ways we're going to start by doing that is, like I was mentioning, kind of reframing our understanding of migraine as a disease. And so often what you're going to hear, and you may even myself will use this kind of language where we say, oh, I had a migraine today. But really what we want to start saying is that I have migraine, I have this migraine disease, and then I have migraine exacerbations or migraine attacks, or episodes. And so a really good way to kind of start to reframe that understanding is when we think about another disease such as asthma. So we know lots of different people who have asthma and they have this disease all the time, but most of the time they're doing pretty well and they're not having a lot of exacerbations or attacks. But whenever they do, we say, oh, they had an asthma attack. And so their symptoms got worse at that time. But we don't just say when they have one, oh, they had an asthma. They had an asthma today. We know that it's a disorder or a disease that they have at all the time. And then there can be times when those episodes are worsening and they can have exacerbations. So that's one of the ways we can start to think about overall migraine as a disorder that you have all the time. And then you can have sometimes where there's just worsening of those symptoms.
I would add to that as well, and something I think I'm going to talk about in the next slide, is again remembering that migraine is a neurologic disease, and so it's a problem with the actual brain cells and the neurons in our body, and it's genetic. There's nothing that you did to cause your body to have migraine. It's in your body's makeup, your body's own genetics. So again, that kind of, reframes the disease state a little bit. And so Dr. Iser has already kind of led into this with our migraine language. I'd really like us as a community to stay away from saying, oh, just migraine, oh, just a migraine attack, that type of thing. Again, emphasizing that this is a neurologic disease. Dr. Iser had already mentioned that we use the term migraine to describe the neurologic disease. We don't use the term migraines, just like we don't use the term asthmas or cancers. And for discrete attacks, we'll use migraine attack, migraine episode, etc. I understand that this gets harder when some people maybe have constant and unremitting migraine and you're kind of constantly in an attack. The language can get a little bit harder, but this is all just to help, again, frame this as a disease state and to help it be taken more seriously. Ultimately, it comes down to your preference as well as how you'd prefer to describe your own disease state. When we're talking about medications, this is really important to me as a healthcare professional, that when I'm talking with my patients, when I'm documenting things in my notes in the patient's medical record, I do not use the terms failed when I speak about medications, because I feel that that places some of the blame on the patient. Well, the patient failed this medication. Sumatriptan was failed. Rather, I think it's more descriptive and tells us a lot more about the patient's experience with the medication if we use terms like ineffective or was not well tolerated because side effect A, B, or C. That actually adds a lot more detail to the patient's medical record, to your medical record, and reminds me in the future why I might not want to try a certain medicine if I think it might have the same side effects as another, or things like that. So that's an important thing that we as providers use, that I think as patients you can use as well, and say when you're describing the medications you've tried in the past, this one was ineffective for me, this one caused side effects, etc. Another term that you may hear in the migraine community is medication overuse headache. We're kind of trying to get away from that term a little bit, because again, that can kind of place some blame on the patient. If you're using an acute or an as-needed medicine more than about 12 times per month, we know that that can worsen your underlying migraine disease state. But you're obviously not doing it on purpose. You're doing it because you're having frequent migraine attacks and you're trying to treat your pain and your symptoms. And so that term medication overuse headache can kind of feel like putting some blame on the patient for just trying to treat their condition, their underlying disease. Rather, we're working more towards terms like medication adaptation headache, which describes that worsening of the headache disease when as-needed medications are being taken too frequently, or things like rebound headache that we know can happen when certain medications are taken frequently. And then finally, using the term migraine sufferer or migraineur is again something we're kind of trying to work away from. Although I do know patients that very much identify with some of these terms, migraine sufferer or migraineur, and those are their preferred terms to describe their experience with their disease state. I'll tell you, I am a person with migraine, and I personally refer to myself as a person with migraine disease or living with migraine. And I refer to really, everyone that I know with migraine as migraine warriors, because people with migraine are some of the strongest people that I know. So this is just kind of an overview of some of the language that I personally try to use and use in my office visits with my patients. And I've seen my patients kind of learn these same pieces of language to describe their disease.
And so, like Dr. Arca was talking about how important language is, photos are part of that language, since we know, photos pictures can be worth 1,000 words. And so, we often will see migraine depicted, whether on commercials or posters or anything like that, is often a white woman who's frail, who looks like she's in a lot of pain and can't do something. But really, we know that there's people with migraine, can be males, can be females, can be young, even children, all the way to older individuals, and can be people who are white, people of color as well. And so we need to go ahead and continue to show that people with migraine look like your everyday people, and they are still going about their lives and still functioning, and they aren't always looking like they're in pain, even if they are in pain. And so we need to continue to go ahead and show that side of migraine, and so that people understand that just because they're not showing you what they are experiencing does not mean that they are not experiencing migraine and having to deal with that on a frequent basis. And again, so this is showing it's a disease state, and it's not something that they're dealing with. You may be dealing with it constantly, but some people are not dealing with it constantly. Just kind of like we were talking about, that when you have asthma, they have it all the time, but it doesn't mean that they're always dealing with an exacerbation or attack at that point. And so that's just a really important part to keep in mind.
So when you're meeting with one of your doctors, whether it's a headache specialist, a neurologist, or your primary care physician, it's really important to include migraine as part of your medical history. I actually can't tell you how many times that I'm seeing maybe a patient that's new to me for migraine or for another neurologic reason. And they have had migraine for many years and it never made it into their medical chart, even though they're on multiple medications that treat migraine. And for some reason, it just doesn't come up. And so I think that that's, I mean, a starting line thing here is to remember to include migraine disease as part of your medical history when you're meeting with a new doctor. Maybe you're in the emergency department or things like that. It is a medical condition and it needs to be part of your medical history. And you know, when you're talking, you know, with your providers that may not be headache specialists, it's also really important to distinguish between causes and triggers. So I had mentioned earlier, for all of you on this talk with migraine, you did not cause yourself to have migraine disease. It's a neurologic disease. It's a genetic disease. That is the cause. However, there can be triggers that exacerbate your disease. Again, harping back to something like asthma, environmental changes, and things like that. We know when allergens are very abundant, that might trigger an asthma attack. Well, similar things for migraine, things like barometric changes, certain foods, etc. Everyone is going to have different triggers, and you're not always going to identify a specific trigger because we know that regardless of how well we do with sleep, with eating, and taking care of ourselves, that migraine can just come regardless of all of that. So it can be helpful to identify triggers if that can reduce your frequency of attacks. But again, we really want to distinguish between causes and triggers and take that blame away from yourself and from our patients.
And so another way you can try to self-advocate can be getting rid of the phrase, "I'm fine," which is something that even I personally do all the time. I think overall everyone does that in general. But even when you're going to your doctor's office visits, I can't tell you the number of times that I talk to my patients and they just say, "I'm fine." And you have to be like, okay, well, what does that mean? And tell me a little bit more about what you mean when you're saying "I'm fine." So it's trying to get rid of that phrase. And really coming to them and letting them know what you are experiencing. And so, we often recommend our patients to do headache diaries, and that's because we want you to come in and say, "Hey, so this is the symptoms I'm experiencing. And these are the number of days that I couldn't do the things I needed to do." And so that really is impactful for us, even as a provider, because we know what it's doing in terms of affecting your life at that time. And it can be really helpful to us to kind of know how we can serve you better. And so you want your provider to know what you are experiencing. And it also showing them, if it's affecting your work opportunities. Is it affecting your social life? Are you not able to go to different concerts or different events with your friends or attend that family event? Those are things to show that it's impacting you and how we need to be more aggressive with treating you at that time. And even go to the emergency room. That's always a really big deal, especially during the recent pandemic. That puts you and your family at risk. And so we always want to do things to try to avoid that. And also showing how it may be affecting your relationships with people. Sometimes having to cancel events with or plans with family or friends can start to create strain there. And so letting them know that it's affecting those relationships. And also letting them know what you've tried and the different workups that you've had so that you can try to move past that and utilize that time to try to find what would be new treatments for you or new workups that may need to be done, and showing that you have ideas and you have questions and letting them know that you're interested in, taking control of this disease state and trying to do your best to work with them and make sure they're going to work with you about trying to help get you better.
So basically, all of this that we're talking about is to really kind of increase migraine disease visibility. We've focused to this point, to this part on a lot of the language regarding migraine. Dr. Iser's last slide really highlighted the ways that you can make your disease visible to your doctor in an office visit. Basically, we are the way that we're going to make migraine visible by us sharing our stories, by us sharing our experiences with this disease. That is going to put the spotlight on migraine.
And so we have
make migraine visible. Oh, sorry.
Sorry.
Go ahead.
Okay. Yeah, so we have to make migraine visible by talking about it more. And it doesn't mean that you have to, get up on a stage in some sort of large event or be leading certain talks here and, within Miles for Migraine. It can start small, just even talking about it with your friends or talking about it with your family and coworkers or classmates and letting them know what it is you're experiencing. Or even when you hear them say something about migraine, saying, oh, it's just migraine is just a bad headache. And so trying to take those opportunities to kind of educate people about it. So just learning to talk about it more and not just leaning on that easy crutch of just saying, oh, I'm fine today. Thank you, I'm fine. And but being willing to bring it up and mention what you're going through.
And like Dr. Iser was saying, we can start small and go big. That might just mean even sharing it with your immediate family members. Again, getting rid of that I'm fine phrase and actually sharing with them what you're going through. We realize that this opens you up to a lot of potential criticisms and critiques and uncomfortable situations. So it will be all based on your preferences and what you feel comfortable with. But if you start kind of moving that radar a little bit each time, I think you can be surprised with how big you can go with sharing your disease visibility.
And so this starts with having those conversations with your doctor who you're supposed to be telling about, what it is you're going through. And if you are experiencing really migraine attacks or really frequent headaches, and then starting to have those conversations with your family and friends and letting them know what's going on and maybe why you had to cancel those plans that day. And you will be surprised how often when you start talking about it, how many of them are experiencing something similar, or one of their kids or their spouses or their other family members. And it's just not something we talk about. So really starting to have those conversations, you'll realize that other people are also experiencing something similar. And then you can start to kind of grow that, and you can start to take part of more speaking engagements. And that Miles for Migraine is a great way to start getting involved with all of that and starting to share your story more with people. And they even have, advocacy training if you want to go into an even larger scale and kind of talk to you about how do you come up with those elevator speeches or kind of pitch talks so that you can kind of quickly let them know about migraine. And then going to social media and using your social media accounts to try to expose a little bit more, bring more awareness to migraine by posting pictures, whether you're at a Miles for Migraine race or maybe reposting something that was like really educational for you about migraine, and then taking part in the races and showing up for those to kind of show your support. And then also you can, when you're doing fundraising, that gives you another opportunity to reach out to all of your loved ones and let them know a little bit more about migraine.
Some of the nice things about social media, and some of this is specific to certain types of social media, is that you can use things that other people have posted before independently kind of posting your own thoughts. So for instance, on Twitter, which is a hugely educational social media platform, you can retweet before you feel comfortable independently tweeting something yourself. And that still amplifies the message, spreads the word. Another nice thing about social media is you can remain anonymous. Nobody needs to know that it's you. There's actually a lot of, Twitter's the only one that I use, and there's a lot of people on Twitter that have anonymous screen names, but they're huge in the migraine community and with the word that they spread. You can be of help to other patients even through social media. Maybe you see something else that somebody posted and you can comment, sounds like maybe you need to see a headache specialist. Have you visited the American Migraine Foundation website yet? No one's asking you to give medical advice, of course. Even as physicians, we don't give medical advice over social media platforms. But these are great ways to share some of these other educational opportunities with other people. And another kind of really nice thing is sometimes you can even still participate in social media when you're not feeling well. Still, being on your phone or your computer while you're resting in bed, maybe that's all you can tolerate during the day, but still being engaged with that migraine community over social media could be helpful to you. All right, so now we're going to move on to our kind of, I think, third segment of this talk, which we're going to talk about shattering stigma surrounding migraine. Dr. Iser, I forgot if I'm going to be the patient or you're going to be the patient.
I can be the patient for this one. All right. So oftentimes we're talking to someone and you can be saying, so I'm having a migraine attack today.
Why? What did you do?
Well, I didn't do anything. I'm having a migraine attack because I have the neurological disease of migraine. So that's something you'll sometimes have exacerbations.
You're having migraine again? Didn't you have 3 last week?
Well, actually, I have the neurological disease of migraine that is there all the time, every day. And yes, I had 3 attacks last week and another one today.
So these are some of our kind of migraine comebacks to try to reject guilt and blame. So we'll move on to another one.
I can be this one. All right. So I feel like you shouldn't be having this many headaches. Has your doctor checked an MRI?
Actually, yes or no. But migraine isn't diagnosed or treated with an MRI.
Oh, okay. I get migraine too, but I can still come to work.
Migraine has a very variable spectrum of severity. There are some days I can come to work and other days I just can't. Can't you just take some Tylenol or Advil?
I could, but there's actually more migraine specific treatments, and I'm working with my provider right now to try to find the best one for me.
Just take your mind off of it.
So biofeedback techniques and mindfulness are definitely a part of migraine treatment, but it's usually not that simple and it often doesn't work enough for me.
All right, so those are just kind of some of our fun migraine comebacks. I hope that you'll find that maybe you can use those in your day-to-day life to, again, try to help reframe migraine disease, help your migraine disease be more visible, and so that all together we can shatter stigma. So thank you so much, everybody, for attending our talk today. It was wonderful speaking with all of you.
Well, thank you, Dr. Arca.